All right, everybody. Thank you for jumping on the call tonight. We are going to just get started here. If you have any questions, there's a note box or a question box. Please feel free to put your questions there. We will be addressing them at the end. So let's just get started. Hi, everyone. My name is Julie Gramick. I've been a clinician for the last 18 and a half years, owned my own practice, and I'm so honored to be here to talk about my two favorite subjects, Resiliélle Exosomes, exosomes in general, and the TargetCool device. So I just want to let everyone know that we're excited to have you here, and we look forward to maybe just giving you some pearls on these two particular products. And I wanted to introduce my fellow uh, co-person today is Chris Ruckel. He is the sales manager with TargetCool. Hi, Chris.
Hi. Hi, everyone. Appreciate you joining today. Really excited to share information about the TargetCool and Resiliélle Exosomes. Um, yeah, if you have any questions, like Julie said, there is a question and answer box in the upper right-hand corner. You can feel free to answer or ask those questions, and we'll answer those at the end. I myself have about 16 years of aesthetic sales experience within the industry. So very excited to share with you two innovative technologies that we really think can enhance your patients' outcomes as well as add to your profitability in your practice.
Yeah, that's my third favorite thing to talk about is that profitability, that ROI. So we are going to be talking about combining Resiliélle exosomes with the TargetCool delivery system. And our agenda is we'll talk about the exosomes in an overview, TargetCool in an overview, and then how we incorporated the two together. Very happy to be here as your moderator today.
And lastly, at the end, we'll be sharing a special promo with you that you can take advantage of.
Thank you, Chris. Yes. So let's just get started. It's funny. I've been trying to take a almost 2 hour training on exosomes and kind of compress it down to just a few minutes. So bear with me. If you ever have any questions on the exosomes, feel free to put the questions in, like Chris said, or just reach out to me, and I would be happy to, go into more detail about the exosomes. So, what are exosomes? Again, it's a very complicated conversation because it's not just about the exosomes, but you have to understand where exosomes come from, and they do come from stem cells. And every cell in the body does make stem cells and have exosomes, but it's all about like what type of stem cells that you need to have specific duties of the exosomes. So in aesthetic medicine, we use products like bone marrow, adipose tissue, perinatal tissue. And I'm going to just kind of start right there and just say that the first two, the bone marrow and the adipose tissue, are not what we're going to be talking about today, but I do have great information about them. They do have purposes, but for aesthetic purposes, the exosomes coming from the perinatal tissue is even more potent and more powerful, more efficacious. So what are exosomes? They're cellular communicators. They're part of the extracellular matrix that a stem cell produces and kind of spits out. And so there's multiple sized extracellular vesicles. And the reason we want to talk about exosomes as opposed to any of the others is because the exosomes are the key crucial communication devices, products between the cell and being able to heal. So in the rejuvenation world that we live in this industry, we do need something that is that delivery system. What is it delivering? It's actually delivering a message that says, hey, you need to heal, you're broken. And then here are the tools, the cargo, here are the tools that your cell needs for rejuvenation. So perinatal tissue, like I said, actually has the most potent tools in these exosome toolboxes. And so, this is just that very or like lightweight education about exosomes, but they are a key important role in aesthetic hair and wound healing. They deliver ingredients like proteins and cytokines and nucleic acids, but they also have, depending on the source, they have over 400 growth factors. So they're more powerful than just a growth factor product that you'll see on the market today that just maybe will give you 12, maybe 3, 4, 5. We give you 400. So these are really important, crucial healing elements in this product, and they come from the perinatal tissue. They're the most tested on the market in the world today for regenerative medicine. They have over 32,000 actually articles published on the reason for utilizing exosomes in healing.
And Julie
What can
brought up
exosomes?
regenerative medicine, and
Yes,
that is the buzzword right now that's going on in the
yes.
industry. Regenerative medicine. A lot of
Hmm.
people are trying to tackle that, and I think exosomes are obviously at the forefront of that. We're seeing that with all the clinical data that's coming out. The push towards utilizing exosomes in the future, and so I think that that's a great segue into what exosomes can actually do.
Yes, absolutely. So regenerative medicine is looked at as the new gold standard. Instead of trying to make somebody look different, why not just enhance what they have? And that is the beautiful point of exosomes, is because they actually help the cells reset and revitalize to the extent that it can turn back the hand of time. It can make you look and feel better. The cells, and it doesn't really matter what cells you're working on, hair, skin, scalp, and full rejuvenation through the regenerative medicine types of product. But the exosomes have been found to be the number one source to reset those cells. So, we can talk topically about what exosomes can do, like reducing the downtime. Who doesn't want that in their practice, to reduce the downtime and the risk factors that come from that inflammatory response? It enhances product penetration. It retains moisture in the cellular level better than even hyaluronic acid has ever been thought to do. It's actually causing this amazing hydration. So everybody, skin wise, needs that hydration, and the exosomes do that. They pull the water in instead of just keeping it from escaping. So it
And Julie,
stimulates collagen.
I think
Go ahead.
a key takeaway here is like, look, you have one powerhouse product and you see the
Yes.
list of what you're able to treat with
Yes.
that. So you look at post-inflammation,
Hmm.
so that could be laser treatments, heat-based
Yes.
treatments, anything along those lines as well. You're looking at collagen production, tissue repair, skin tone, acne. There's so
Yes.
many treatments that you can literally do off of just utilizing one product. That's what's
Just one
really
product.
invigorating about Resiliélle Exosomes.
Yeah, and that's true. The stimulating collagen, most companies really like to say that they stimulate collagen after 3 treatments or whatever. But you have to have a powerhouse to help build those collagen and elastin fibers. And this exosome is the powerhouse. Resilié's exosome is the powerhouse, and I can actually tell you why. So exosomes, like I said, come in, different from different sources. But the age zero Resiliélle exosomes, they come from the youngest aged stem cells that are ever around, and they come from a perinatal tissue called Wharton's jelly. And that Wharton's jelly is super, like I call it the eighth wonder of the world, because it really is the most important critical perinatal tissue. And it's because not only is this gelatinous product supporting the the umbilical cord so it doesn't crush on the vessels. So that's really important to keep, the baby healthy. But it also filters out and makes it safe for the mom and the baby to communicate with each other. So it's only giving just good connection and good communication between the mom and the baby. And that's really important, because if you had, adipose tissue, you only have one message. With this, you have all of this beautiful message to repair and all of the tools that just built a human. And they're glorious. And I do think of them as the eighth wonder of the world. And with exosomes coming from Resiliélle, we're also following the industry standard of low passage. That just means that we're not over processing them. We're only giving a 4-passage process and keeping it an exact replica of that message that the stem cell is providing. So there's no wiggle room, there's no fear of the unknown or differentiation or mutation. It's the exact message. So when you talk about low passage, you think about like an exact copy, a Xerox copy of an original form. If you take that copy and you go 100 passes, you're going to get grainy. It's not going to look clear and crisp. But if you do 4, you're going to have a beautiful, equal quality copy from that original form. And that's what we do with H0. We're American made, we're American donors, we're immune privileged. What that means to me is that you'll never have a client or a recipient have an allergic reaction. There is not another product out there like this. It is considered a universal donor for that immune privilege situation. It's never going to cause an allergic reaction. We also are biologically active. That just means that it's ready to be used and took in your body, like, used right away. It's frozen, never lyophilized, and we're suspended in clinical grade saline. We're counted and characterized, so we know what we have in our vial, and that means something to the safety and efficacy of our product moving forward for your clients. It's CLIA lab tested, which means it's a certified testing. We don't just tell you that it's good. We actually put our money where our mouth is and get it third party tested every single time, every single batch, every single vial is counted, characterized, and certified. I love that.
Julie, what I think also is very interesting is you look at different exosomes that are on the market, right? And
Yes.
Resiliélle stands out in that it's coming from Morton's jelly. So you think
Yes.
about it, what I like to think about is the best time your cells turn over is what? When you are the youngest, right? So
Yes.
when you utilize sometimes what some of those other adipose tissue or whatnot, those cells can actually be already 20 or 30 years old that they're utilizing to replicate that. And so you're
Yes.
not getting that amazing turnover of cells that you would get when it's, when you're first born and your cells are completely turning over at their youngest stage.
Yeah, interesting that you bring that up because Chris, we're born with the exact number of stem cells that we'll ever have, and they're the mesenchymal stem cells that are for reparative mechanisms. They're used up. 2/3 of them are used up within the first year of life. The first year, 2/3. So 58-year-old me, I have very, very few healing mesenchymal stem cells floating around. So when I'm getting a big treatment like a CO2 laser or a microdermabrasion, I want the flooding of these exosomes into my skin to give the tools that's necessary for repair. So you're right. It's so amazing how we can actually look at a child scraping his knee and how quickly that heals versus an older person like myself that I scrape my knees all the time and how long it takes for me to heal without the exosomes. Yeah, for sure. So this is the certificate of conformity that I was talking about. This just kind of shows you, I have a whole hour on this as a training, so we won't go there. But it shows you that we do a lot of testing for the safety of your patients. We do really value that quality and safety, and we are the number one, the manufacturer that creates the most volume of the age zero stem cells and exosomes in the world. And we do it. We have over 31,000 studies going on, and all because we are the safest and most efficacious product on the market, and we have a certificate to prove that. It's not, it's not just us saying it.
I think that's another quality that stands out with Resilié versus what's on the market. No
Yeah.
other brand is putting together a report that is so in depth and to show
Yes.
you that the safety is there and the potency is there.
Yeah, and believe it or not, if you ask for the test results that go along with this certificate, it's a 64-page report that we can send you. So it's not just this, but it's that 64-page of all of the test results that we provide to an office as needed. So it's pretty cool. So we've done a clinical study, a 100-patient clinical study. One of the funniest things to me about clinical studies is that some companies, they think that when they get a 20 or 30% change or improvement, they're screaming it from the top of the Empire State Building, going, "Oh my gosh, we got these results." Our test results, our clinical trial results, were in the high 70s, 80s, and 90 percentile. So we know that our quality and efficaciousness with this clinical trial, we did nothing different than we would do, have you do in your clinic to provide these results. They are just outstanding results. And no other company can really tell you that they're getting high 70s, 80s, and 90% in all categories. There was not one category that was less than the high, that high 70s. So it's a pretty significant study that proves that our product is the most efficacious out on the market today. Here's some just results. So 92.6% improvement in radiance, and you can really just see the quality of her skin, her skin tone, texture, everything about this skin is just so beautiful and so different. The reduction in pigmentation, and that wasn't even that wasn't what this picture was supposed to be showing, but everybody got the results, so it was hard not to. 85% reduction in redness. So who doesn't want that post-inflammatory response to be reduced to 2 hours, maybe a day at the most, even with a big treatment? That's what exosomes do. They start that healing cascade so quickly that within 2 hours, this patient sent a picture in saying, "Did my skin actually get this treatment? Because it looks so beautiful directly after the treatment," that she was used to having, 7 days of downtime. So,
This photo really stands out to me.
yeah.
Everyone's doing these laser-based treatments, chemical peels, things of that nature. And a
Mhm.
big thing for patients is really reducing that
Yeah.
post-inflammatory response, changing that downtime scenario. And so
Yes.
I think that that's really where these can fit in for, every office that's out
For
there. I mean, you see
every
that
office.
2 hours post-procedure and look at the
Mhm.
changes in that texture and that color of the skin. So
Yeah.
I think that that's a
Yeah.
great opportunity for people.
If this wasn't my personal patient, I wouldn't have believed it. Seriously, because it was just so quick to respond in such a beautiful way. And she wrote that her skin wasn't hot and irritated, and the swelling went down. Everything about it just was such a relief to her for that
I
for
also
that
noticed
treatment.
another thing with this is, patients make the best referral sources, right?
Yes.
So if her experience is amazing, she's going to tell other people, and that is a way to draw more business into your
Yes.
practice as well. So that word of mouth advertising, there's nothing like it.
Yes, and that kind of is funny. We didn't have time really to talk about that, but we had two editors part of this 100 patient study. One was from Vogue and one was from The Cut, and both of them had such an amazing response and change in their skin that they asked us to write about the product. Of course, we're going to say yes because that's such a great, like you said, that referral, unbiased opinion is so powerful. But that is what it's all about, Chris, is providing the best product on the market to get the best outcomes in the safest way. It's truly amazing. I've got one more quick picture here, and this was the 88.9% reduction in spots and pigmentation. This skin looks so much younger and so much better to me. I'm impressed with this particular one. I love what it did for her overall redness and pigmentation, and look at the fine lines and the smoothness of the skin. This is pretty impressive to me.
Yeah, the pigment
So
changes are exceptional
yeah,
utilizing the product for sure.
yeah, absolutely. And what exosomes do and what our exosomes do is it actually does from the top down, it pixelates that pigment, and then from the bottom up, it actually protects or blocks the fibroblasts from producing pigment. So when you're doing a treatment, you can have that post-inflammatory hyperpigmentation because the skin, the fibroblast is ready to go, it's ready to charge. And with our product, it blocks that charge. So it's giving a protective mechanism like no other on the market. Like seriously, I can do a little bit more aggressive even with people that could potentially get melasma, because I'm giving them a 72-hour protective mechanism for that inflammatory response to come down, and that pigmentation says, oh, I don't need to, go or fire because it's cool. Everything's good now. So I love that about our exosomes and the cargo. There's so much to learn about exosomes. I can't tell you how difficult it was to leave out little key pieces. But again, my exosome education is 2 hours long. So if anyone has questions about exosomes or wants any information about exosomes, feel free to reach out to me. I love that subject. I am called the crazy exosome lady for a reason, because I have got years of experience now with it. And I did a deep dive, and I do have some global education certifications, and I'd be happy to answer questions. But this is the second part of my favorite thing about this is the application method. So exosomes are, especially in saline, they're watery, they're not gelatinous. And so over the last 2 years, it was part of my job to find the best application method to deliver the exosomes onto people's skin. Of course, there's the original dropper with the syringe, where you drop, 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 drop. But then there was something that, some people could get, and it's a little sprayer, whatever. But when I found the TargetCool, okay, the TargetCool found me, I found them, whatever. Um, I have to say that it quickly, I mean, Chris, how quickly it became my favorite treatment. I wouldn't even give you back your device because I just love this treatment. Um, can you tell us a little bit about the Target Cool so that we can, talk about that combination treatment?
Yeah, of course. So the TargetCool is a revolutionary FDA cleared class 2 medical device. It's completely handheld and cordless. So you can move it room to room, very easy to maneuver. It utilizes CO2 gas. So this is actually food grade CO2 gas. So it's completely safe to spray around the mouth, the eyes, anything of that nature. But it has the real focus of the device is precision cooling. So we're trying to cool the skin to make treatments more comfortable for patients. So yeah, utilizing the CO2 gas, it's able to spray at high speeds and drive solutions through this little container here into the skin. So uniformly down to the dermal epidermal junction and beyond. And we will show more information on that shortly. But yeah, just wanted to show you kind of what it looks like here. Weighs about maybe a pound. It's very lightweight, easy to maneuver between your office.
When I first saw that device, when you mentioned it to me, and I first saw it, I really was kind of nervous about it. I thought, oh man, is it going to be too, too heavy, too bulky? But man, it sure does. Just like you were showing, it sure does like move with your hand. It's super lightweight, and it's weighted so nicely that when you have it in your hand and you're doing the treatment, it's almost like weightless. It doesn't feel like a pound in your hand. It feels very easy to control, and it's part of your hand. And I love that about the device. I really appreciate that, because it did look a little bulky at first, right? And so I told you, I think way back when I was like, oh, is that really heavy? Is that, really bulky? So I love how easy it is to yield. So now we're going to talk about the TargetCool product overview, and that's you, Chris.
Yeah, so we're going to dive in here on the next screen. It's going to have a little video that shows kind of what's happening, in illustration video that shows, kind of the TargetCool, what we like to call boosting. We're boosting solutions, especially Resiliélle Exosomes, into the skin. And so this kind of shows how that works. So you'll see that the solution is being driven out of the front, and it actually crystallizes the solution so that we're then able to deliver it into the skin at a high velocity. We like to call it, we've kind of coined the term ice needling for it. So if you see that term, it's something that we've kind of coined for that, or if we reference that, then you kind of understand, kind of what we've come up with. It's creating these ice needling formations from the solution and driving that down into the skin.
One
And
of
then
my
this next,
favorite things, yeah, one of my favorite things about that, Chris, is that it is not painful. It's actually very cooling and soothing. And most people, especially if they've just gotten a big, laser treatment or maybe a chemical peel or something, their skin is hot and irritated, and oh, it just feels so luxurious. That's what I hear my clients say, is it feels luxurious.
you're right. You're exactly right. It allows for cooling and then also solution delivery. So we're
Yeah,
tackling both of those with one device.
yeah,
And
yeah.
then this video here is an extremely slowed down video, 1,000 times slowed down. And you will see that the spray is actually going into a gelatinous matrix, a skin-like matrix, and it's forming these almost eyelash looking channels into that gel. And you could see as it continues to spray, those channels are being formed longer and longer. And again, this is just a slow motion video, but we wanted to give you an illustration just to show you, that depth of penetration is there literally from just spraying this device, not even touching the skin with the device. We're able to create these channels and deliver solutions down to where you're needing them to be, to make skin changes down to the dermal epidermal junction and into the dermis.
Yeah, that's the most important thing for me is, like that superficial delivery of the exosomes, then allow in that uniform pattern. I love that, because there's nothing better out there. I can't do it by dropping and massaging. This is that uniform delivery system that creates almost like a a really nice layer of the exosomes, very superficially up, up in that top layer, so then they can cascade down and heal where they need to heal. And that's one of the coolest things about exosomes in general, is that our exosomes have a homing mechanism. So you put them there and they will find the cells that are broken down and needing repair, all on their own. So it's really cool. I love this. And it does, you're right, look like eyelashes.
What's also amazing too is that, there's some legalities in different states where some places, depending on your certifications, that you're maybe not able to microneedle or microchannel.
Hmm.
This creates an opportunity for you that you normally wouldn't have, right? You're able to not even touch the patient's skin with the device, but still offer this channeling and this solution delivery. So it's amazing for those types of providers that are looking for a solution to offer more options to their patients.
You're right. I didn't even think about that at the time, but because, exosomes and some skin boosters and that sort of thing, they're not FDA cleared to be injected into the skin. And where are they best? They're best delivered into the skin, right? So you have to rather do, a big laser or a micro needling, and those are uncomfortable for your patients. But now you have TargetCool that delivers them just in the right place without pain, no downtime, and it delivers them so uniformly without having to create an injury. I love that, Chris. I really think that that's what makes the TargetCool so unique in this landscape of aesthetic medicine, is that this can be delegated to anybody in your office that is trained and able to use them, because you're not injecting anything. And I love that.
Yeah, that's great.
So talk
So
about this slide, Chris, because this is interesting to me.
yeah, so
Very
this
interesting.
slide, it shows the solution delivery, the depth of penetration utilizing TargetCool. So we actually compared hyaluronic acid only, just topically applied onto the skin. So you'll see in the upper right-hand corner, that is that first illustration right there.
Mhm.
And you could see, some solution is getting in, but it's not getting really down to where you really want it to. And then we step down to the next one, and this is actually hyaluronic acid after microneedling and TargetCool, utilizing both options. And so you can see that those solutions are definitely getting down further into the skin, but you've also used microneedling, right? You've created those channels. So this bottom one here, this actually shows just TargetCool with hyaluronic acid. And you can see the uniform penetration that is given around the dermal epidermal junction, and it's pushing that solution in, I would like to say, even greater
Yeah.
than utilizing microneedling and TargetCool. So that begs to differ, like, why would you utilize both options when you can actually get a similar or better efficacy just using the TargetCool, right?
Yeah.
So, I
Yeah.
mean, we showed 165% increase in comparison, from the original chart to that final chart. So, we wanted to give you that depth of penetration and show you that, what you're spraying is actually getting into where we're trying to make it go. And I think this illustrates that perfectly.
Yeah, I agree. And like we know, you can definitely do it after microneedling if you really want that microneedling reparative mechanism. But this just proves to me that you don't need that step. But those people that want it, they can still do it. But yeah, in my
You're
practice,
exactly, you're
in,
exactly
in my
right. It can be
practice,
used
I
in
took it away.
conjunction.
Yeah,
Yeah, it
yeah,
can be
yeah,
used in conjunction with any of these other, devices.
yeah.
But just showing you that that solution delivery is real similar to, what you could
Mhm.
do with microchanneling. So if you're just trying to drive solutions into the skin, you don't need to create an injury to do that. And I think that's what we're trying to show you.
Right. Yeah. And the amount of time saving, we'll talk about that, but the time saving is so much better when you don't microneedle, because it's so much more comfortable and it's super quick and you don't have to numb. Yeah, we'll talk about that. But so we're going to be talking about combining the Resiliélle exosomes and the TargetCool. And we've got a couple of before and after pictures that are pretty impressive. but we're going to talk about how to integrate this treatment into your practice. Like Chris had said, you can if you're a microneedler and or a laser person, you can use the TargetCool with Resiliélle for the after effect and delivery of that exosome, because the exosomes are going to help, quickly heal the skin, start the healing process, inflammatory response, all of those things. But so does the TargetCool. And I really love that cooling effect uses that Bohr effect, which everybody is now sort of hearing about, for that injury, for a reparative mechanism, for an even better outcome. And that's why in my practice, I think that this combination treatment is is a game changer. It's something that you can't get alone. You can't get it with just microneedling. You can't get it with just laser. But the two together have created a game changer for practices. So, talk about, how it goes great with the energy-based treatments, Chris. But I'm telling you, that simple treatment takes less than 15 minutes, and it's a game changer for my practice, because now I can do 4 to 5 treatments in an hour versus one.
Yeah, you can speed up your chair time, with your patients and still give them really great results. And we have further slides that are going to touch on that and show you kind of like profitability and things of that nature. But yeah,
Hmm.
we'll continue on with like some of the benefits of utilizing TargetCool with the Resiliélle exosomes in combination.
Yeah, so this was two TargetCool treatments with our 10 billion age zero exosomes delivered one month apart. So there's two treatments. So here is the baseline picture. Look at all of the undulation, the lifting, the scaly, the pigmentation versus just two treatments within 6 months of each other. These pictures are all of that extra smoothness, the collagen formation, the pigment reduction. That skin looks good. Looks better than it did for sure.
Yeah, significant change there. You look at the collagen formation, the pigment changes, the texture, the clarity of the skin,
Hmm.
just with two treatments. It's pretty
Two
amazing.
treatments. Yeah. Pretty impressive. So these are one treatment of hair treatment with the TargetCool and the 10 billion exosomes. This particular client, the pictures are 25 days apart, and you can see all of the baby hair, new growth. This patient was super happy with, how it was starting. And again, these pictures are just to kind of show you the beginning stages of what's happening with these treatments and how powerful they are in just 25 days. It's
And
pretty
also wanted
impressive.
to touch on ease of use with the target
Yes,
cool and the scalp,
yes.
right? So
Mhm.
treating the scalp when there's hair involved can be very difficult, right? Like you're microneedling the hair, you're trying to figure out how to maneuver it. Target cool
Mhm.
changes that scenario. You're able to just part the hair on the scalp and spray down that parted line versus trying to fight the hair with microneedling and things of that nature. So you actually can give a better overall treatment because you're able to get areas that maybe you wouldn't be able to from a microneedling standpoint when it comes to the scalp.
Yeah, I agree. And they take around less than 10 minutes to do in and out of your office. So this is one of the things that I love about this treatment. This is 30 days apart from the original picture to the second picture. And one of the best things that I can show you is that the hair in the second picture is coming out stronger and more lifted. And the reason for that is because the exosomes are working around that hair shaft to support and build collagen and elastin and allow the hair to be stronger and come out the way it's supposed to come out. So instead of all of this hair laying down and looking so limp and lifeless, look at this hair. This is 30 days apart after one treatment. And of course, that scalp, look at that difference in the scalp. This gentleman had hair plugs that went bad, that just didn't work for him. So he got a lot of scarring. And so we're able to, with this treatment, help that scarring and help the hair growth so significantly for this guy. He's so pleased. And this was just one treatment. He's now done four. So he's pretty pleased. This particular treatment was not meant to grow hair, to be honest. Like, I thought this guy's hair was done. Like, I just didn't expect any hair growth. But I did have this challenge of the scalp. It's very waxy, has no vascularity, the pigmentation, it has some scaling. So when I did the treatment, this is again 30 days apart. Look at all that baby hair, man. That is impressive to me, but I do love that it's helping that scalp. It's giving it pigmentation, or it's giving it vascularity. It's removing the pigmentation. There is no waxiness to it. It's looking healthy, and I love that treatment.
Yeah, this is an amazing before and after photo with it.
Yeah,
You look at the, how much better the skin looks, from a
yeah,
vascularization standpoint. So I think like the cooling mechanism and you're oxygenating, the skin, and
yes,
then compounding that with Resiliélle exosomes to message and, change the turnover of the cells.
yeah,
I mean, that's just a huge improvement right there.
yeah. You can definitely tell that it woke some things up. That reset, restore.
Yeah.
So now let's talk, Chris, about some numbers. To me, these are very conservative numbers because I live it. I have been doing these treatments and making, easy work out of making more profit for myself. But this is pretty powerful numbers.
Yeah, so we put some numbers together both for hair restoration and for facial rejuvenation. So first, this one is going over the hair restoration side. We were extremely conservative with these numbers.
Yeah,
Again, these numbers can vary across the country based on demographic and
yeah,
your patient population and all of that. But we wanted to give you some numbers just to kind of show you an idea. So on this hair restoration, we show a package of 3 treatments that the patient pays $1,650 for. Your cost of goods per treatment would be around roughly $150. So if you multiply that by 3, it's $450 there. So that would net you a profit of $1,200 or more. And again, it's a fast treatment time. You're looking at, I mean, this says 15 to 20 minutes. You could really do this in 10 to 15 minutes
10. Yeah.
if you really
Hmm.
wanted to and you got this, system down. But
Yeah.
as you can see, we wanted to show you not only is this an efficacious and a great way to treat patients in a new way and get them really great results, but we also wanted to build your profitability, right, and get you new customers that you can now target and market to draw more people into your office. And
Yeah.
so, you look at this, and from an annual standpoint, just doing it off of these numbers, it's close to $60,000 in profit, that you
Mhm.
can realize just from offering these hair restoration treatments just in this package format that we're showing right here.
Yeah, no, I love it. And I definitely know what it's done for my practice and the hair treatments that I do. Um, and because the clients love the treatment, they send referrals to me all the time, all the time. I definitely love the referrals, right? We all love the referrals. So this is that skin package or the facial package. And I think again, this is probably on the more conservative side, but it's based on um, location, right? It's like an average price for the treatment.
Yeah, we have markets that are charging more like $600, $700 for some of
Yeah.
these treatments for one, right? So those package prices can go up, but again, we were very conservative on this side of it. You see a package of 3 here for facial rejuvenation is $1,050. Your cost of goods is 107 per treatment. So you're looking at around $320 for your total cost of goods for the full 3 treatments. So when you subtract that from what the patient has paid, it leaves you a profitability of around $729, and that's per rejuvenation, or per package of facial rejuvenation. Again, quick timing to do these treatments, and just off of these numbers, this is a profit of near $70,000. So imagine
Yeah.
in your practice you have probably subscription patients set up on these subscriptions. Imagine being able to add this to that opportunity. You can quickly treat them. It allows you to get more subscriptions. You can even speed up the time frame that a
Yeah.
patient is spending in between treatments. We can treat them a little bit quicker doing it this route. You could set these up for 2 weeks or every 3 week treatments scenarios as well. So that will drive them to have more chair time with you guys as well. So yeah, between the hair restoration and the facial rejuvenation packages, I mean, these are great opportunities for immense profitability within your practice.
Yeah, and there is a big thing right now which drives me crazy, but okay, where people are doing microneedling for acne, and I'm an old-fashioned microneedler. I used to use a needle, just one. I was the device, and yes, I'm that old, Chris. But the funny thing about that is that now it's being thought as a good thing to microneedle right over active acne. With this device, number one, you don't need to microneedle over anything purulent, and you will drive in the exosomes and help restore that skin so much faster, so much more comfortable. The patients can come in more regularly. They'll want to come in more regularly, and it is it's good to know that you should be looking at it for the efficaciousness and the outcomes. But we're talking profitability here, and there's nothing. This is a game changer in practices today. Like if I could start my practice over again 18 years back and have this device and this exosome, I don't think I would have to need any other device or product, and I would have a very lucrative practice.
Yeah, I like to say I've never met a med spa that operates as a charity, right? Like
Yeah,
they're there to also make money and stay in business and pay for employees
yeah,
and new innovations. And so that's you got to be a driving force to have that profitability. And I think that we have these options here that can definitely do that for you.
yeah. So let's talk about this deal, Chris. This is an
Yeah.
amazing deal. 18 free treatments
Yeah.
to make your money back. Tell me about this.
Yeah, so we're really excited. This is a package that we've combined the TargetCool with Resiliélle Exosomes to give you basically everything you need to be a cutting edge practice and offer these treatments. Um, the package is offered at 6,500, and this includes the TargetCool device, all your consumables, as well as 9 vials of the Resiliélle Exosomes. And so this is a complete package that will allow you to do 18 plus treatments. So if you just charge kind of like the minimum standards that we were showing you in terms of profitability for your treatments, that is enough to completely pay off this purchase as well as net you some profit on top of that. So we have people that have literally bought this package and within a month have paid off, their full initial purchase of the device. And so this
Yeah.
is a great opportunity. We have this QR code on the left-hand side there. We'd love for you to, if you want to fill that out and let us know if you're interested in taking advantage of this opportunity. We're going to leave this up on the screen so that you can, feel free to scan that as you need. And then we also, again, for those of you who weren't on at the start, there is a question and answer question box in the upper right-hand corner. If you have any questions, we'd love to hear from you and be able to answer, any questions that may pop up for you. So we're going to go ahead and leave that on the screen, and then we're going to check the question box.
I do have a question for you, Chris. So tell me about your training. So once someone purchases it, gets this delivered to them, tell me how they get trained.
Yeah, so we don't want you just to purchase this and then you never hear from us again, right? Our goal is to, this is such a unique device and unique opportunity that we want to make sure that you feel completely proficient with utilizing the device, not only you, but your staff as well, right? And so we do full webinar based trainings where we go over everything to make sure that you are, proficient, how to put the device together, how to draw up the solution, how to spray it, and all of that so that we make sure that you're accurate and utilizing it in the proper format. We're always here for you as well. If you have questions, you can reach out at any time. We have a team that will answer, those questions and make sure that everything, is taken care of, or any questions that you have are dealt with. So yeah, this includes that full, training involved as well. So yeah, it's a great opportunity.
Yeah, I loved my training with you. I loved my training with Peter, and Jen. Everybody has just been so valuable with, how easy this device. It's easy and simple, but yet you need that support. And I love that you guys have provided that support. Yeah.
Yes. I have a question too that came in, more for the Resiliélle Exosomes side. They're asking, why is lyophilized an important consideration for exosomes?
So lyophilization is considered bad actually. And the reason for it is because you're taking this biologically active, functional, beautiful cylinder that has a bilipid layer and it's full of all of these tools, and then you're squeezing the water out of it and breaking that down. And once you do that, you take away the functionality. It no longer can go to a broken down cell and communicate with it because it doesn't have that messaging anymore. It doesn't have this beautiful lipid bilayer that needs to be attached to a cell to communicate. And then the worst part about lyophilization, believe it or not, is the fact that once you've drawn out all that water, you crush or disperse like the growth factors and the cytokines and the interleukins and all of these beautiful things that you want from an exosome. We just had we were fortunate to be on the good side of this Harvard study they did about lyophilization versus fully intact exosomes. And they found that the key people in the industry that sells exosomes that are lyophilized, they did this blinded test and proved that they had nothing but broken down proteins. They had no ability for it to function, and they found zero fully functional exosomes in their lyophilized product. Versus, again, we were lucky to be in this blinded study. We didn't know we were going to be participating be in, and they found us to be perfectly intact and ready to go. And I just love that knowledge because I've I've learned that over the last 5 years, but having Harvard Medical School confirm it was a game changer for me and our company for sure.
Yeah, it's an amazing study when you
Yeah.
compare lyophilization between the different products and,
Mhm.
the differences there. So
Yeah. Yeah. So I think that's great. I'm super happy to be on that winning side, if you will, but it's pretty impressive. So
yeah, yeah,
important.
that's the questions that I see in the question
Yep.
box. So
Hmm.
what I'd like to do, if you guys have any further questions, whether it's TargetCool related, Resiliélle Exosome related, please feel free to scan, that QR code, and in there you can leave us notes, and we'll be able to respond back to you if and answer any questions that you may have, or provide you with any further information that you're wanting. So
Yeah.
yeah, but we appreciate you guys attending this webinar. I hope it was, educational and informative for you. And we look forward to you, bringing on TargetCool and Resiliélle Exosomes.
Yes, definitely. I'm so excited. Thank you so much, Chris, for having me on. Appreciate it.
Thank you, Julie. Appreciate you.
Mhm.